have Kipper coming in for surgery. Kipper has what we call a soft tissue sarcoma, so it's a lump that's found on his ventral chest. We have recommended that he has that removed today.
I'm very nervous today, but I have full faith in the staff that his anaesthetic will go okay, and then they get the whole lump and they'll be setting it away to make sure that it's all removed.
So we need to pop a catheter in Kipper's arm to administer the anaesthetic agents. So, you've been very good, Kipper. I'm proud of you. You're a good boy.
Hi everyone, I'm David and I work here at Jervis Bay Vet Clinic. This is our dog Kipper. He's in here for surgery today. He's an 8-year-old Kelpie Cross dog and he has a low-grade soft tissue sarcoma on his stomach, and we're going to try and remove that today. So first we're going to induce the anaesthetic using propofol, and he's got intravenous fluids running here. So now we're going to get that underway. Now we've already done a blood test on Kipper before surgery this morning, just checking that his liver and his kidneys are okay and that he's not dehydrated. Intravenous fluids will help to keep his blood pressure up as much as possible whilst he's under the anaesthetic, and we'll monitor everything as closely as we can to make sure that he's safe. Kipper's feeling pretty relaxed already, so my nurse Megan here is going to help us to get the tube into his airway. Find his airway and insert the tube like that. And connecting up to the anaesthetic machine, checking that the flow rate is correct and that there's oxygen going through, which it is. So Megan's inflating the cuff, which makes sure there's no leakage of anaesthetic gases. And I'm attaching a pulse oximeter to Kipper's tongue so we can see the oxygen saturation of the capillaries and also monitor Kipper's heart rate during the procedure. So here we are in Kipper's surgical procedure, and I'm wearing sterile gloves and a sterile gown, face mask and hat, and we are going to remove this lump. Doesn't look like much, but that lump has been biopsied and we know that it's a soft tissue sarcoma. Now, we do know that it's low grade, which means it doesn't have a high potential for spread, but it certainly is a malignant tumour, and it needs to be removed with wide margins. We don't want to have any chance of leaving any of this tumour material behind, so we're going to make an incision from about here to here and here to here. So we're going to give a good few centimetres right around this tumour and go quite deep underneath it to make sure we get all of the abnormal tissue. And if we get all the abnormal tissue out, we've got a really high chance of cure and of stopping this thing from spreading. Alright, so we'll just start with a wide skin incision around the tumour to make sure that we sort of map out our area completely, because once we start to take skin away, we lose the sort of orientation of where we started. Okay, so now we've removed all of the tumour material along with a fascial plane and some muscle underneath the tumour, and we pop it into a jar containing formalin, which preserves the lump, and from there the pathologist can section it up and look at it to see and confirm what type of tumour it is. And also, and just as important, is did we get clear margins of normal tissue right around the tumour itself.
Alright, so Kipper's come back today to get his drain taken out, and as you can see the wound looks really good. So we're just going to remove the drain because it's been in for about 6 days now. We're really happy to see Kipper go home doing so well. His wound looks amazing, but we will see him back in a further 8 days' time to get his sutures out. Now we do ask if any of your animals show any lumps or bumps that you're not sure about, that you bring them into your vet for us to check them. The longer you leave them, the worse they can get.